A 54-year-old footballer presents to the orthopedic clinic with the complaints of knee pain. Your task is to do the examination of the knee joint. So today about the knee joint examination, what are the points we need to do and what are the tests we need to do while performing a knee joint examination. So as like any other examination, we need to introduce, confirm the patient identity, wash your hands, explain the procedure to the patient that we are going to do certain tests in the knee joint and confirm if there is any pain. He will be gentle, and if there is any pain, he can stop and let us know. And we need to expose the patient below the umbilicus. He can wear the underwear. And if it is a female patient, make sure that you have a chaperone along with you. Ask the patient to stand, and before you proceed with the further examination, make sure that the patient doesn't have any pain. So these are the things we will be going around, and we'll be discussing about the knee joint in each one of these following categories. So first, during the inspection, we need to look at the scan the place to look for any walking aids. So we would be looking at if there are walking aids, we will ask them like how they are walking up. Okay, then we will ask the patient, request the patient to stand up, and we would be observing at aspiratory walk, and we'll be looking at if there is any limping, any instability of the knee joint, or if there is any limited mobility. The next one, we will look at the position of the knee joint, whether if it is neutral, if there is any valgus or varus deformity, if there is any flexion deformity, or any hyperextension deformity. You can perform a squat test, but preferably you can avoid it in an elderly because they might be difficult for them to perform a squat test. Then we can ask the patient to lie down supine on a couch, and we'll be observing the knee joint. So what we need to look into is the skin over the joint, the color, the symmetry, and if there are any scars. In regard to the shape, look at for any swellings and the alignment of the knee joint. Okay, and you need to look for the patellar alignments. Okay, that is the femoral tibial alignment as well as the patellar alignments. Position of the knee joint, you look for valgus and varus deformity and any hyperextension, which is called as recurvatum. We need to measure the quadriceps bulk. So usually one hand above the patella. So make a measurement tape and measure the quadriceps bulk on both the right and the left knee joints. Okay. The next one we will be looking at the field palpation. So we need to look for if there is any temperature with the dorsum of our hands, and if there is any tenderness, palpate the bony prominences, the lower end of femoral condyles, the joint line, the patella around the rim of the patella, as well as in the tibial tuberosity. So you need to look for any tenderness along this. So while performing this, it will be better if you perform with the knee in slight flexion. The next one, you ask the patient to stretch, extend the knee joint, and you need to perform these three tests to look for any effusion. If there is a small amount of effusion, you can do what is called as a bulge sign. So here we will be moving, we'll be pressing the right hand from the below the femur to over the suprapatellar, so the suprapatellar region, and then we will make a swipe from the medial to the lateral side of the patella and look for any bulge on the lateral side. And similarly, we will make a sweep from the lateral towards the medial side and look for any loss of dimple. So this is called as the bulge sign. The next one is the patellar tap. So here also, this is usually used when there is a large amount of effusion. So we will tap the fluid from the suprapatellar bursa, and we will just make a small press over the top of the patella and look if we can feel for the effusion on either sides of the patella. The cross fluctuation tests. So this is how it's been done. So there is cross fluctuation test. The hand is they are moving the hand from the above to the suprapatellar, and here this below the patella it is fixed, and then we will be looking for any loss of dimple on either sides of the patella. We will then look at the palpate the knee joint for any synovial thickening, and also palpate the surrounding structures like the ligaments, the medial and the lateral collateral ligaments, the and also the ligamentum patella. Also, you can palpate the tibial tuberosity and the femoral condyles to find out if there are any tender points over this region. Coming to the patella, you can palpate the size of the patella on both sides, the height, and you can perform the friction test and the apprehension test. The apprehension test will make the push the patella slightly towards the lateral side and ask the person to extend the knee joint. So if the patella is going to move more on the lateral side, so that's called as a patella apprehension test. So that indicates the recurrent patellar dislocation. So in those things, the patellar apprehension test will be positive. The friction test is also similar, where a strong pressure will be applied from the patella superiorly over the patella, with the patient in the knee in the extended posture and slightly flexed posture. Okay, so we will be looking for if there is any exacerbation in the pain. The next one, we will be looking for the movements of the knee joint. So we will be asking the person to do active movements, flexion, extension, and straight leg rising to find out if there is any abnormality or if there is any restriction in movements. The passive movements, you need to look for any crepitus or any clicks which you can feel while moving the knee joint. The other special test, we will be doing a certain special test, as we know that the knee joint has got a lot of ligaments around it. Okay, so some of the tests are the collateral ligament stress test. So here the patient's knee is slightly flexed, and we will be applying a force on the medial side and make a slight varus stress to look for any deviation and any exacerbation in the pain. And similarly, another valgus stress test where the force is applied on the lateral side and a slight valgus is performed by holding the foot of the patient. So this indicates if there is any pain on the opposite side. So this is called as collateral ligament. The next sign is the posterior sac sign. So here what happens, the person's knee is kept at 90 degrees with the hip flexion and the knee flexion, and we will be looking at the sagging of the tibia posteriorly. Okay, so if there is a sagging, so this indicates that the tibia goes posteriorly. So this is a posterior cruciate ligament injury. So in this case, this is positive. The posterior sac test will be positive. Dryer test. So here the patient's foot, the patient sits over the patient's, the examiner sits over the patient's foot to hold it, and we need to explain this to the patient, and then we will be holding the palm of the four fingers near the popliteal fossa. Okay, and make an upward press over the hamstrings, the tendon of the hamstrings, so that the person relaxes the hamstrings. Okay, and then make a slight gentle push. Okay, make sure that the thumb is present on the inferior aspect over the tibial tuberosity. So give a gentle forward push, which is the anterior drawer test, and the gentle backward push, which is the posterior drawer test, so which indicates both the anterior and the posterior cruciate ligament injury, respectively. The Lashman test. So this is also another cruciate ligament injury. So test for cruciate ligament injury. So here usually the knee is flexed around 30 degrees, and then we will be applying a force on the anterior as well as on the we'll pull the tibia. Okay, and on either ways we'll be doing it, and we'll look for any abnormal movements. So this is called as the Lashman test, and if there is any exacerbated movements or any pain during the movements, that indicates the cruciate ligament is injured. The McMurray's test, this is performed for meniscus, both the medial and the lateral meniscus. Ask the person to flex the knee as well as the hip joint. Okay, the examiner holds the feet with one hand and the other hand is held near the knee joint. Now the examiner then makes a gentle internal rotation. So he makes an internal rotation of the foot. Okay, and at the same time he applies a varus stress. So this, if there is a pain, it indicates lateral meniscus. Similarly, he performs the other one on the other direction, that is externally rotate the foot and then apply a valgus stress. So that might indicate, if there is a pain, that might indicate that it's a medial meniscus test, medial meniscus injury. So this, while performing this test, the examiner also slightly extends the knee joint. Okay, so he makes an internal rotation and then slightly extends the knee joint to find out if there is any pain. So, and if there is a pain, that indicates that there is a injury to the meniscus. The Aplis grind test. So this is usually a more painful test. So we'll reserve this at the last, and we will perform only if the examiner asks us to do it. So we will ask the person to lie down in this in the prone position, and here what happens, the knee is flexed, and usually the some books describe the examiner holds the thigh with one of the foots. He then applies a force through the foot. Okay, and then makes a slight internal as well as the lateral external rotation, and if there is any pain, that might indicate that there is a meniscal injury. So this is called as Apley's grinding test. While the patient is in the prone position, also make take this opportunity to examine the popliteal fossa and look for any presence of Baker's cyst. We need to uh, do other tests, as the knee joint pain would be because of other pain. That is, we would be doing an hip and an ankle examination as well, and also a cardiovascular and a complete neurological examination to rule out any other systemic involvement. With this, we come to the end of the knee joint examination. Thank you.